Thank you so much, Nicole. Oh my gosh, it's so lovely to be back in the DISC community, the DISC village. I definitely miss you all and being at these meetings more regularly. Right. Can you all see my screen?
Yes,
Perfect.
looks
All
great.
right. So today I will be talking about expanding D&I science capacity locally and globally, and we'll be walking through the two fairly recent DISC publications from the last year about how to evaluate and promote D&I capacity. Like Nicole shared, one is a systematic review of capacity building programs that are similar to the DISC. And then another is our own process evaluation of DISC activities and operations. Acknowledgements include the DISC executive leadership team, particularly Nicole and Borshika for co-leading these projects and guiding all of our work. And we had a fantastic team of DISC research interns during those inaugural years who supported data collection and data organization, Nicholas Lee, Jillian Abasta, KCU, and Melanie Aguilar, and then fiscal and organizational support from the ACTRI and the DISC. So a roadmap for today's talk, we're going to cover some background in D&I science capacity building. We're going to talk through the two papers and summarize the findings, and then discuss takeaways kind of across both publications. And then I have a couple of discussion questions in case we have time, but feel free to ask questions throughout today. I just want to pause for a moment. Here are the two papers that we'll be discussing. If you do want to snap a pic of the QR codes and download the papers, or I'm sure we can drop those in the chat. Oh, yes.
So sorry, it may just be me, but it looks like the slides are sort of in transition, and it's like we can see half of one slide and half of another.
Oh, weird. Okay, let me
Do
see.
you want to unshare and reshare maybe?
Yeah, it maybe just paused.
Yeah, I'm not sure.
Okay, let's see. Tell me now.
Okay, that looks beautiful. Okay, but then it's sort of kind of puzzle piecey.
So funny. Okay, let's try another way. Let me just try to redo this really quickly because that is not going to be helpful.
Okay, that looks good. Yeah, I think that's great.
Okay. Let's go with this, and then just stop me if there are other errors. I was in a presentation this morning where nobody interrupted and there were like PowerPoint problems and notes showing and things throughout. And so I don't want to be that person today. So definitely interrupt me if there's other issues. But here are the two DISC publications we'll be talking about. So D&I has grown tremendously over the past kind of 10, 15, 20 years. There's a substantial increase in implementation science submissions and publications. There's increased D&I funding available. Interest globally, especially from organizations like the World Health Organization, who puts out an implementation report guiding implementation research periodically. And of the 27 institutes and centers at the NIH, 18 participate in the program announcement for the D&I research and health. And, you know, with this rise of interest and opportunity, there have been capacity building programs that have developed focusing on D&I training, mentorship, and individual and institutional capacity building. So programs similar to the DISC have been developed in the last 15, 20 years, both nationally and internationally. But still, the demand for training and mentorship in D&I far exceeds available opportunities. For example, the NIH-funded TI-DIRC program received like 265 applicants for 35 slots in the first year. And the NIH and VA-funded programs like IRI routinely receive kind of multiple applications for every single fellowship slot. So finding ways to accelerate the pace of D&I capacity building and training has been recognized as an international and national priority. The publications I'm talking about today are positioned within a body of recent research in capacity building in D&I. There's a lot happening in this space. A couple of publications I wanted to highlight for you all to check out. One is a content analysis of D&I resource initiatives, specifically kind of what types of resources exist in D&I, what's out there, and what might be most effective. A review of training initiatives in D&I, a systematic review similar to the systematic review we're talking about today, but a little bit distinct because they're focusing on teaching and training initiatives. A paper on competencies for D&I, what trainees need to learn and where they learn it. And then a paper in 2022 led by Borshika, promoting rigor and sustainment in D&I capacity building programs. And they, I think, Borshika, you can correct if this is wrong, but focused on kind of longitudinal specific training programs and the factors that influence sustainability. So the first paper that we led at the DISC is a systematic review of D&I capacity building programs around the globe. And this is kind of one of the first comprehensive inventories of US and international D&I centers, cataloging information about activities and infrastructure and priorities. And this project seeks to identify and describe those programs that exist and look at their activities and strategies to bolster D&I capacity building. It's a little bit of a wordy slide, but I wanted to make sure we were on the same page about what is a capacity building program. And we were intentionally looking for kind of multi-resource, multi-activity programs similar to the DISC. So we define capacity building as an entity, like an organization, program, or center, with at least one capacity building activity, which could be consultation, technical assistance, networking events, journal clubs, with a focus on building practical knowledge and skills to conduct D&I, and a focus within the realm of public or population health work. Interestingly, in this review, we did find, D&I type programs within like agricultural fields and industry and kind of groups outside of population or public health. So here are the phases of our review. So the first phase focused on D&I program identification. We conducted structured Google searches and systematically extracted results. The second phase involved RA-supported screening of Google results and a secondary review of DISC by the DISC leadership, and a review also by external D&I experts. The third phase involved additional targeted program searches to both kind of validate our initial list, but also see if there were any programs that we were missing. And we looked at kind of funding mechanisms like CTSA, P&U awarded programs. And then we screened our results for duplicates and then added sort of missing programs. Then the fourth phase, we reviewed websites and abstracted information to complete sort of a table of information of all of those programs. And then we sent out a survey to the lead contact at each of these programs to gather more specific targeted information about activities. So phase one was this kind of series of structured Google searches for D&I. We use the term dissemination and implementation. And as you might imagine, it's quite broad. So the list of programs was kind of ranging across many different fields. And then we had 9 synonyms that are common both within and outside of the United States, like diffusion, knowledge transfer, even improvement science, with and without the word program, along with 13 synonyms for program. So center, collaborative, institute. And the first 50 search results from each of these searches were extracted using the program Appify, like an online web scraping tool, because if you run the same search in Google, you won't get the same results. So to avoid kind of changing results, we used Appify to automatically extract the results into tables. So the specific word combinations and the number of results can be found in table 1 if you're curious and want to look there. Phase 2 involved screening the websites using specific inclusion criteria, looking at kind of entities or organizations following our definition, and making sure that at least one, so more than 2 activities, D&I specific activities. And so RA supported the round of review of the first initial web pages, which was 7,000. Then myself reviewed all of those that were included from the RA review. And then we had Borshika and Nicole, 2 faculty researchers, independently review half, and then they cross-checked each other's half to confirm inclusion. And then we consulted D&I experts, both nationally and internationally recognized experts in the field, to conduct a review of our findings and add any programs that they might suspect that were missing. And these experts included those with international reputation in D&I, government funding, D&I experts who have been involved in sort of specific capacity building activities. And then we looked at NIH Reporter. Like I mentioned, we wanted to kind of make sure that we were including programs. And so we looked at U01s and P50s and CTSA associated programs and CTSA funding or groups to see if there were D&I specific organizations that we might have been missing. Then we reviewed each program's website to describe the D&I concentration and program activity. So information was abstracted by research assistants using an iteratively developed abstraction form. So the fields that we pulled from the website included kind of locational information, the D&I concentration, D&I, whether it was DI or QI. There were many programs in QI, knowledge translation, policy, or community engagement, and they could have multiple concentrations. And this was us tagging what we kind of identified from their website, as well as specific capacity building activities. So to gather information about each CBP, we also emailed the primary contact identified for each program, and the survey was structured following the domains of a typical logic model, but most specifically following kind of the operations and the methods that WashU used to develop their model. So the domain included inputs like funding and human resources, activities, training, mentorship, outputs, grant outcomes, academic outcomes, and long-term public health outcomes guided by the translational science benefits model. The survey also captured evaluation methods and D&I competencies or frameworks. And the outputs also included whether the programs specialized in a D&I product or specific resource. And they were able to elaborate on any resources or activities with open text responses. So here are the results. A brief snapshot of the review in terms of numbers. So we conducted 140 searches, which we had 7,000 search results in our initial kind of sample of the websites. After removing duplicates and those not meeting the criteria, we retained 696. There were many duplicate sites, and some of these sites did not meet criteria, so we narrowed the sample to 186. And then with the faculty review, we resulted in additional removal of 69. Through expert review, we added, as well as doing those grant review through NIH Reporter. So the grand total, it was 165 programs. And that is also visible in the Prisma diagram, but this is really small. You would need a microscope to see this. And you can see how the sample narrowed to 165 in that red box. And then we sent everybody a survey and landed on about half completed the survey, 87. So of the final sample of 165, most at 68% are in the United States. And we are kind of limited because the searches were done in English. And so, and then also we reviewed, funding and grants through the kind of US specific funding mechanisms. And so we were, a limitation is that we were more likely to identify US-based programs, but we intentionally had kind of global experts in the field try to identify additional programs. But so most were in the United States. We had a number of programs, about 30 in Western Europe, and then 17 in Canada, and then a few in Australia, 2 in Asia, and 1 in Africa and Nigeria. So, and we didn't have any in South America. And so kind of global representation is a little bit limited, and there are kind of few programs in low and middle income countries. 131 had a concentration in D&I, and they could be identified with multiple concentrations here. But what's interesting is nearly 50 of the 165 had a focus also in quality improvement. So there's a strong overlap between QI and D&I, and then knowledge translation, about 30, and that's a term more typical that I've seen outside of the United States, and then fewer in policy and fewer in community engagement. Policy is definitely a growing interest area and is unique and important kind of space for development in this area. So in table 2, you can see the full list of the programs, and definitely please scan it if there's other programs that come to mind that are not there. I think we would love to know about them as well. So 87 sites completed the survey, and most of the respondents were in the United States. Most were affiliated with an academic institution, but a kind of 30% were not affiliated with an academic institution. So it's definitely not a requirement, and not necessarily like everyone was at a university. So I thought that was interesting. Sources of financial support for the program varied pretty widely. About half identified their sources as long-term or ongoing. Research grants and program grants were the most commonly reported financial support. Internal institutional funds were also fairly common, but more organizations reported program or research grants. And then highlighted in the red box here, the fees for services, fewer programs reported educational or course fees, membership fees, or fees for services. I'm at the tail end of a cold, so I'm just gonna have my lozenge at the same time as I'm talking. For activities, there are many types of D&I capacity building activities offered, but training and education was most frequently reported. And the less frequently reported was things like internships for students or trainees. And that's kind of similar across when we asked specifically about training. Webinars and seminars were most popular, and less popular, and a potential area for growth are integrating trainings into medical programs and master's or doctoral level programs. The majority of the sites endorsed tracking academic metrics like publications, grants from program members, but fewer sites reported tracking whether there was a resultant uptake of research findings. So this is uptake of findings from kind of mentored members or members involved in the programs, whether their research findings were taken up in the community for community or societal level influence or impact. And so fewer were kind of tracking these productivity measures. And about half reported tracking evaluation metrics annually. More common was a little less frequent. Longer term outcomes and impact measurement from these programs was less common. Specifically, we're interested in translational science benefits model. So a screen grab of the framework here. Outcomes are listed here in blue. So you can see the translational science benefits model, health and societal benefits. We asked specifically about clinical and medical benefits, community and public health benefits, economic benefits, and policy and legislative benefits. And it was interesting that like a 27% reported yes, that they track TSBI indicators for evaluation. I thought that was surprising, given the relative recency of the translational science benefits model. And the benefits model looks at like population health level benefits, like policy change, procedures into practice, cost effectiveness, cost savings. And when we asked which specific categories of the model that organizations are tracking, it was kind of evenly split amongst the different areas of health and society. So this review identified 165 D&I programs, with most having more than 2 DIS activities. And although there is the limitation that the review was kind of conducted in English, and we did identify many programs outside of the US, especially in kind of Western Europe and Canada. Several opportunities remain to enhance capacity building efforts. Specifically, shared metrics to compare program operations and impacts would be ideal. Priorities include sustainment strategies for these programs, so advocating for different types of funding, whether that's internal funding or fee for service operations, although most of these programs are intentionally left kind of public and open. They I know, it makes sense to kind of try to diversify funding sources in order for the longevity of these programs and to make sure that we're continuing to offer services. And then there's definitely a need for more programs internationally, specifically programs in low and middle income countries. And for formal certification, low cost accessible options for learners in LMIC, so opportunities for practitioners, non-researchers, like many kind of people with a medical or clinical background come to the DISC for consultation. So we see it anecdotally as a need to expand D&I offerings for those within different fields and within different degrees. All right. Just checking the chat to see if I'm missing anything. Okay. Any questions? I'm just going to pause and have a sip of my water. Like I said, a tail end of a cough here. Okay. All right, so switching gears, talking about our process evaluation for the DISC. So we evaluated our activities and operations here at the DISC at kind of at the end of our second year. And the goals were to outline the evaluation of our academically housed D&I capacity building program, the DISC, and describe the development of our logic model to capture both academic products and scientific outcomes. In case you didn't already know, the DISC does a lot with a small, lean team. They do a lot and it's awesome. And they host a variety of activities, which broadly include technical assistance, resource sharing, consultation, grant review, networking and collaboration opportunities, and targeted trainings and skill building. So we used the DISC logic model to guide a process evaluation to assess how engagement in DISC activities translates into scientific products, outputs, and outcomes. And we also wanted to explore how to improve the DISC using feedback from members. The DISC asks for feedback several times throughout the year, so we want to make sure we make use of it to improve our services. And the DISC evaluation for year one was done kind of at the end of 2020 and year two at the end of 2021. And this paper reports on kind of both of those evaluation years together. And it's a multi-method approach to evaluation. There are surveys, attendance tracking, feedback forms, and documentation of grant outcomes. And it takes quite a bit of work to make sure we kind of get all of that data. This is our version 1.0 of the DISC logic model that was developed right at the start of DISC in early 2020. And this version of the logic model follows the structure of WashU's D&I program logic model. We have our slated objectives that funnel into activities, outputs, into outcomes, and impact and ROI, return on investment. And then we wanted to integrate the translational science benefits model. It continues to gain a lot of traction in the CTSA, amongst the CTSA funded programs. And it's helpful for the DISC to not only sort of comprehensively capture population or societal level impacts, but also to align the DISC with across ACTRI or RCTSA funded initiatives and programs. So this is our version 2 logic model, which aligns more closely with the TSBI model. Includes resources, activities, traditional scientific outputs, but also in green are the key additions from the translational science benefits model with economic, policy, public health, and community health outcomes. So the sources of evaluation data are broad and diverse, and we kind of flexibly evaluate DISC's impact through multiple methods and multiple time points throughout each year. I want to say this with the caveat that things may have shifted in the past couple of years. And so it might be interesting at the end to talk about some of the changes from the evaluation patterns that we initially had in the first few years. The sources of data include both survey data from members, but also data from tracking databases like our media platform, our newsletters, web analytics. In the interest of time, I won't go into tremendous depth on each of these areas of evaluation, but there's kind of richer methodological description in the paper, and I'm happy to answer any questions at the end. The DISC membership application, you all would likely have completed it, but it collects basic demographic information and information about interest area and background. The annual evaluation, which is out now, kind of more closely resembles the logic model and asks about activities and outputs and outcomes. And specifically kind of what did you do as a result of being a DISC member for the year? The DISC consultation system invites feedback on the consultation experience, as well as tracks projects and grant outcomes kind of specifically related to your DISC consultation. So what did you do or change or submit or publish as a result of participating in your DISC consultation? DISC media tracking refers to a collection of different media and tracking databases. So DISC has a Twitter presence, we have the website, we have our newsletters. What else am I missing? And then YouTube. YouTube. And then we also had, for the first couple of years, I don't know if this has continued to in some different form, but we had Clockify where we were tracking hours spent on different activities and hours spent on consultation. Then we have DISC attendance tracking, which refers to our attendance and satisfaction tracking for each seminar and workshop. And then we have qualitative and open-ended feedback, which is really important. I think we learn a lot from open-ended sources, and that's intentionally integrated across these different various touch points, and especially the surveys often involve open-ended feedback. Okay, jumping into results, and again, we can circle back to additional methods questions if there are specific questions about any of those surveys. So at the end of year one, there were 343 DISC members. I'd actually be really curious to hear how things have grown. Year two, we had an additional 197 members, so a total of 540. The professor series was the most frequently reported membership type. And then for year two, something that jumped out was the students portion grew, at least in terms of the second column is calculated based on total new members. And so 60 of that 197 is a greater proportion than the first year. So students grew as well. The proportion of the most common type of member was, again, university faculty. And of the total DISC members, most members identified as white or Asian, and that kind of stayed fairly consistent year one to year two. DISC members reported multiple topics of interest. Psychiatry, mental health, and public health continued to be most popular from year one to year two. More than half in year one were associated also with the UC system, but that decreased kind of significantly in the second year. There was a greater proportion of those outside of California in the second year of the DISC. About half responded to the annual survey in year one. And after a lot of growth in membership, we had fewer respondents to the annual evaluation, about 20% in year two. We may have just had a smaller, sort of more engaged cohort at the beginning, but there were kind of fewer respondents to the annual evaluation in year two. We, in order to remind for the annual evaluation, typically it's multiple reminders and then a raffle incentive, which I think has stayed consistent. DISC members that do complete the evaluation are pretty active. More than 95% endorse participation in at least one activity. And I think there were more than 60% across year one and year two. So more than half reported 3 activities or more. Outputs, grant submission, and mentoring grant submission actually, and mentoring for the career award, right, were most popular outputs in year one. Grant submission and a new scientific collaborator was most popular reported outputs in year two. So I think that's pretty kind of very neat that the DISC so intentionally promotes collaborations and community and networking as well. Across newsletters, website, Twitter, journal club, and our implementation science seminars. So newsletters increased from year 1 to year 2. Our click rate, our open rate, our web visits, our unique web visitors, Twitter followers all increased from year 1 to year 2. DISC Journal Club, the average attendance was fairly small in the beginning, and it increased from an average of 18 to an average of 25 year 2 and continues to grow. The implementation science seminars had a period, kind of a pause period. And so they were not quite as popular after the pandemic, I think. But after collapsing the journal club and the seminars, I think the attendance has been more consistent. For workshops, year 1 and year 2, year 1, we only had 1 workshop, but it was very highly attended and the satisfaction was high. We had 2 smaller workshops in year 2, also with high kind of satisfaction numbers. Consultation remained consistent from year 1 to year 2. We had 68 consultations year 1, 70 in year 2. And most consultees agreed that consultations were very valuable. Consultations were largely for grant support and project implementation. Those were kind of the most frequently reported reasons for desiring a DISC consultation. And most of the grant consultations or proposal consultations were for K or R level NIH grants. And funding from grant support. So grants that had DISC consultation were funded, and that was about 19% in year 1 and 16% in year 2. So kind of consistent from year 1 to year 2 in terms of the number of grants that were funded and where DISC consultation was involved. Across the qualitative feedback, so themes include, this is very kind of broad, high-level themes across many of the areas in which we ask for open-ended feedback. Now, there's a desire for increased diversity, both I think amongst the membership and those and speakers as well. Student-focused content opportunities, increased collaboration opportunities. There's always an interest in online resources and kind of readily available resources. Methods-focused workshops, assistance with D&I, grant writing, equity-oriented research and practice, advancing D&I skills to move from a novice to a more advanced D&I user, and interest in practical application of D&I. A few highlighted quotes, very small, but I'll read them off for us here. So a desire for increased diversity, more discussions from scholars of color and scholars from underrepresented backgrounds. There's a desire for methods-focused workshops, so more short methods, short practical trainings. Advancing D&I skills. So I would love a clear roadmap to improve my knowledge and skills in D&I. I have such a limited time to engage in professional development activities. It'd be really helpful if DISC could support me in figuring out what I know and what I do not, and then engage in targeted activities to develop my skills and knowledge in the weaker areas. So, and that came up a little, more often, kind of advancing from a novice D&I user to a more advanced D&I user. And then continuing the focus on equity as central to D&I work. All right, so in terms of conclusions from the second publication, linking activities to scientific outputs, community impacts, and longer-term scientific and population health outcomes can be a really useful way to explore how well programs align with institutional and community priorities. We do recommend that programs include multiple data sources, especially because we know for kind of open-ended satisfaction surveys, the response rates can vary pretty widely. 10, 20, 30% response rates are considered pretty average. And so making sure you're kind of evaluating at different touch points with different ways of engaging members to complete evaluations. And then we recommend that you inform members from the outset that evaluation will be involved at the time point of kind of membership or kind of being oriented into your new member community as a capacity building organization. An evaluation is really important to guide refinement of activities and alignment of resources and to align with institutional priorities, which might help advocating for internal funding. So a few takeaways across the projects, prioritizing technical assistance and supporting grant writing remains an area for growth that came up kind of a lot, both in sort of our internal evaluation, it comes up anecdotally, and was an area that I think could have been sort of more popular amongst the programs identified in the review. And strengthening networking and collaboration opportunities could expand D&I capacity individually and institutionally. Organizing the evaluation using a logic model, especially a tailored specific logic model for your program, is useful, and shared metrics of evaluation could help us compare program operations and impact. And logic models, especially shared logic models like a translational science benefits model, will help us to more readily compare across different programs. And then a live central catalog of these programs is an important future direction of this work. We could, more readily share assets and resources, but we could identify areas of redundancy. Many of the programs we reviewed reported having webinars and seminars, and if there's webinars and seminars that are very similar across programs, we might be able to consolidate kind of offerings and share our assets and resources. All right, that's what I have for reviewing these two papers, but I think we have some time for discussion. So I hope you all have some questions, as well as I have a couple of questions for the group.
Thank you so much, Claire. Oh, it looks like maybe we have some ready questions or reactions. David, I see you unmuted.
Sure. So yeah, just really impressive. Just the information you've shared today, and just I know the team, the leadership team of the DISC really accomplished a lot over the last few years. So sort of my question is a bigger picture question, and sort of ties in, I think, both. Just to what extent, I know Greg and others are involved in Nigeria, and curious to know if there are other larger initiatives or individuals that are focusing more on that kind of low middle income country development as far as kind of D&I capacity development, because I think there is a significant need for that type of work. Takes a fair amount of resources, but just curious if anybody was aware of other either NIH or other actions to try to expand D&I globally, particularly for LMICs.
That's an excellent question. I don't, is Greg in the room, in the Zoom room? Maybe he.
I think he might stepped away. So
and I guess if we don't have the any information about that, I think sort of the comparable is kind of shifting more of thinking about DEI and low resource environments here nationally and locally, opportunities for either trying to develop new capacity development or other even just kind of straight technical assistance for community-based organizations, things like that, just type of opportunities like that.
David, I can jump in and share a little bit more about the capacity building efforts in Nigeria and then other places related to D&I. So there's a mechanism called a G11 that NIH has, and we have one with Nigeria. Greg and Eche Izinolu are the MPIs, and we have just the most amazing research administrators at UCSD who are developing a curriculum with University of Nigeria research administrators. Number one, to build a foundation in how do you conduct high quality research administration in service of being able to prepare D&I scientists to submit grants and then be able to manage those grants. So that's an example of one effort that we're making here. And I believe that there's another group, Borshika, you'll have to remind me of the name. They're, I think at maybe Harvard. They're part of our implementation science hub that provides technical assistance to ending the HIV epidemic projects. I'm forgetting the name of the investigators, but I believe they also have another G11 very similar to this kind of research infrastructure idea in another LMIC. I can look back at the name in a moment, but there are, you're also blanking on the name. I can see her face. I just can't think of the name. But anyways, Fogarty International in particular, I think is paying special attention to this need to provide more capacity building support across different health areas, but with a special focus on DNI and LMICs.
That's helpful. Thanks. And again, just kudos to you and all the others on the leadership team at DISC, and as far as what's been accomplished locally, it's very impressive.
Donna Spiegelman, I thought of it. Donna Spiegelman has a G11. Thanks.
I don't know if others know about the Center for Implementation too, because they focus on kind of practitioner and community organizations, or at least I kind of partially focus their trainings and activities and some of their capacity building work on practitioners conducting kind of implementation in the community. And so I think they have a lot of really cool resources and graphics and things that can help with, I think, translating some of the concepts to others.
That's a great resource, Claire. The Center of Implementation, I believe they are included in the systematic review. And Kara, our DISC manager, is currently completing their implementation science specialist program. And maybe, Kara, if you want to share more about it, any of your experiences in networking with those outside of the US.
Yeah, so during the course, there's not necessarily like a specific way to, interact with those outside of the US, but we do have like it's like a message board almost of those who are participating in the training, and they are from different countries, different parts of the US, all participating in this training. So we're all kind of learning together and sharing our own experiences as well. And one thing that I've heard from a lot of people is that there's not too much formal training around DNI. And so it's definitely a great course to be able to take to learn some of those fundamental basics, but also figure out how to apply the things that you're learning in the course to possibly a change initiative or something that you might be working on, and really apply those concepts as well.
I'm not sure if we want to go into some of the discussion questions, but if anybody has ideas, I'm always curious about like how programs can better evaluate the uptake of findings. How do we evaluate those longer term translational science benefits? I'm not sure if the DISC has evolved in the ways that they're measuring longer term population kind of health level outcomes, or if the ACTRI has some different sort of thinking around this, because I know I think that they've really adopted the TSBI as their central model for evaluation. So just curious also.
Yeah, so we
This
are
might be
working on the new,
sorry, go
I'm
ahead.
so sorry, yeah.
No, go ahead, Borshika.
In the new proposal for not the renewal, we call it the new proposal, the ANCHET submission for the ACTRI, the TSBM is definitely a key underlying model that we are proposing to use, and the DISC will have some role in helping to implement that. So I think it's a process. We are thinking about it, and of course there are many challenges. And those of you who were able to join in December, Doug Luke was invited for this same space to talk about the TSBM, to help us think about how best to integrated. So hopefully it will happen and we will have good data. And it's definitely a movement, as you mentioned it, Claire, across the translational science institutes. And then also actually NIH level, I have heard multiple initiatives where they are trying to use the TSBM to guide evaluation. So it's all happening.
Thank you. Awesome.
I was just going to mention that this could be a nice time for us, again, to tease what's to come from the DISC in terms of our evaluation efforts. We have now incorporated translational science benefit indicators as questions in our follow-up surveys to those who've been part of any consultation services through the DISC. So we're trying to make a very concerted effort now to use the TSBM in our ongoing evaluation efforts. We haven't yet sent those out yet, so we'll be very curious to see how people respond to it, but we're excited to give it a try. And speaking of evaluation, Kara, I'm noticing that we're close to the top of the hour. I'm wondering if we want to send out our 1 minute, 1 questions evaluation survey. I think, Claire, you actually thought of this idea. We can send it out in the chat just so we gather a little bit of evaluation data before everyone takes off. Any final questions or reactions that anyone wants to share?
No, thank you so much for having me. This is a really neat opportunity to kind of reflect on all the progress that the DISC has made and to share back many of the learnings from the first few years. So perhaps there'll be another presentation to follow up in a year or so's time. So awesome. Thank you.
That'd be great. Thank you so much, Claire. It was a nice reminder of just all the incredible work and attention to detail that you led as part of those review and evaluation efforts. So thank you. We are finalizing our February seminar speaker as we speak, but do save the date for February 15th at 2 p.m. We'll send out more information about the speaker, the mystery speaker, as soon as we have confirmation. But thanks so much, everyone, for joining us. A huge thank you to you, Claire. And hopefully we'll see everyone again February 15th. Thanks, everyone.